Hi, my name is Christine, and today I want to talk to you about monkeypox, since it has been declared a public health emergency of international concern. A public health emergency of international concern is an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease, and to potentially require a coordinated international response. This situation arises when it is a serious, sudden, unusual, or unexpected event, which in turn carries implication for public health beyond the affected state's border. I want you to know the latest updated information and know how to protect yourself and your loved one from the disease. Now let's get started. Monkeypox was first discovered in 1958 in Copenhagen. These monkeys were kept in a research lab in Copenhagen. The source of the reservoir for the disease still remains unknown. Monkeypox is a rare disease that belongs to the orthopox virus group. It is similar to smallpox, however, it is milder. The first human case was first identified in 1970 in the Democratic Republic of the Congo, DRC. Many cases that come into the United States are imported cases from international travel. I'm going to give you a brief timeline of how monkeypox was discovered from the UK to the US. On May 7, the United Kingdom Health Security Agency reported its first case of monkeypox from a traveler returning from Nigeria. On May 14th and 16th, the United Kingdom Health Security Agency identified a second unrelated cluster of 2 cases and a third cluster of 4 cases. These cases were identified at a sexual health clinic. The 4th case cluster involved people who identified as gay, bisexual, or men who have sex with men. On May 17th, a man in Massachusetts returning from international travel received a positive confirmed case of monkeypox from the Laboratory Response Network. CDC confirmed the virus was West African. On May 23rd, the CDC started an incident command system structure to respond to the monkeypox incidents. On July 5th, the case in the United States started increasing. The CDC started a monkeypox task force. On July 23rd, the World Health Organization declared monkeypox a public health emergency of international concern. This is the first time the World Health Organization went against its special advisory recommendation. The reason behind it was because of the rising cases and many cases likely being missed. The unknown mode of transmission, the clear risk of international spread. This declaration could help expedite vaccine development and mitigation efforts. Epidemiological context of monkeypox in the United States. There has been over 3,000 plus cases that has been reported to CDC. 45 states, including the District of Columbia and Puerto Rico. The median age is 37. The range of the age is from 18 to 76 years old. Majority of the people that have been reporting the cases has been men who has sex with men. However, people should not stigmatize these group of people or the LGBT community because there has been cases of children having monkeypox. There has been 19,000 cases globally and a mortality rate of less than 1%. You might be wondering how monkeypox spread. It is spread to the direct contact with infectious rash, scab, or bodily fluid, respiratory secretion during prolonged face-to-face contact, physical contact, kissing, cuddling, sex, spooning, touching item that has previously been contaminated from infectious rash, such as a towel, bed sheets, toilet seats. The virus can stay on the surface of things for up to 15 days. A pregnant mother can spread the virus to the unborn child via placenta. I want you to be aware that it is not a sexually transmitted disease. Using a condom will not protect you from monkeypox. Monkeypox signs and symptoms. You may be wondering what signs and symptoms to look out for if you feel like you might have monkeypox. Well, monkeypox mimics flu-like symptoms such as headaches, muscle aches, backaches, throat pain, cough, swollen lymph node, malaise, fatigues. A rash usually develops 1 to 4 days after any of these symptoms. The rash can appear anywhere, even internally, orally, vaginally, and anally. It is important that if you feel sick, you should seek care from an appropriate healthcare provider. Monkeypox vaccine and treatment. Currently, there are 2 types of vaccines available for monkeypox. One is the Jynneos vaccine and the other one is ACAM 2000. However, right now, there is a limited supply of the vaccine. It is controlled by the federal government. The vaccine is coming from the Strategic National Stockpile, part of the smallpox preparedness plan. Right now, they are giving the vaccine in phases. You should check with your local health department to see what phase you fall under. The Jynneos vaccine is manufactured by Bavarian Nordic. This is a vaccine. You will need to take 2 doses of the vaccine 4 weeks apart. A person is considered fully vaccinated after 2 weeks after the second dose. The Jynneos vaccine should ideally be administered within 4 days of exposure to help prevent the onset of disease. If given between 4 to 14 days of the exposure, the vaccine may help reduce symptoms, but it may not prevent the disease. ACAM 2000 is manufactured by Stéphane Pasteur. It cannot cause the smallpox virus, and it does not contain the smallpox virus. It is a live 2-pronged stainless steel needle that is dipped into a vaccine solution, and the skin is pricked several times in the upper arm with a droplet of the vaccine. The virus begins to grow at the injection site and cause a localized infection or POX to form. A blister develops at the vaccine site and then dries up, forming a scab that falls off in the 3rd week, leaving a scar. A person is considered fully vaccinated after the 4th week of ACAM 2000. Vaccine equity. We know that from the rollout of COVID-19 vaccine that vaccine equity is very important. We need to make sure that people who need to get the vaccine be able to get it. A lot has to do with social determinants of health. High-income countries are being able to stockpile the vaccine, while low-income countries are not being able to stockpile the vaccine. We need to ask government to promote a robust distribution of the vaccine globally, prioritize vaccine access to marginalized community, help ensure strong U.S. foreign assistance funding to address devastating impact of the disease on human rights. There is a treatment for monkeypox called tecovirimat, created by SIGA Pharmaceutical. However, it is also controlled by the federal government, and you need a signed consent form before you can get the medication. Now that we talked a lot about monkeypox, what it is, the signs, symptoms, and treatment, now you might be wondering, how do I protect myself from monkeypox? Well, here it is. Avoid close skin-to-skin contact with people who have a rash or that looks like monkeypox. Do not touch the rash or scab of a person with monkeypox. Do not hug, kiss, cuddle, or have sex with someone with monkeypox. Avoid contact with objects or material that the person with monkeypox may have used. Do not share eating utensils or cups with a person with monkeypox. Do not handle or touch bedding, towels, or clothing with a person with monkeypox. Wash your hands often with soap and water, or use an alcohol-based sanitizer, especially before eating or touching your face or after use of the bathroom. Use cleaning products that are certified by the Environmental Protection Agency to disinfect infectious diseases. Now that we understand monkeypox and its implication on human health, we can better protect ourselves and others around us. As of July 2022, this is what we know. I would like to reiterate that monkeypox is a viral disease. Like with any viral disease, it can evolve quickly. As the virus changes, so should we. I would like to thank you for taking the time to listen to my presentation. Have a great day.